Welcome to Lunchtime with the Masters, brought to you by PICA. I'm Brett Robotsky, and I have the distinction and honor today sitting across from Dr. Michael King. Mike is, past APMA president. He's been on the AMA CPT committee. He's run the CAC committee for the APMA. This man knows coding, billing, and how to actually get money into your pocket because he's been in private practice his whole career. So,
and sometimes I get paid too.
And sometimes he gets paid. Welcome to Lunchtime with the Masters.
Thank you, Brad.
I thought a great topic to talk to you today would be the claim that doesn't get paid. What do we do with it? I mean, how do we appeal it? What's the first step, and how do we get through this?
The first step is don't just let it go, because the plan of the insurer and the third-party payer is to make you want to give up. And so it's easy in our busy practices and the administrative burdens we have to simply give up. And that's exactly what they want us to do.
So they're counting on a certain percentage of people on a denied claim never filing.
Absolutely. Think about it, Brett. What is it called? It's called insurance. We call it health insurance. There's no such thing. It's insurance. And insurance companies rely upon the fact that there will not be claims made against policies. That's how they make their money. And, they serve a purpose, obviously, an important purpose. But if we don't pursue things to the full nth degree, they win. And ultimately, we lose. And so it's important just not let things go.
No. So this added fight, going to appeal, you would almost think that, if they're playing this game of roulette, we should get a bonus for fighting even harder.
Well, wouldn't that be nice if that was the case? I think, if you look at even the governmental side of things, so theoretically, if there's a claim that's outside of the statute of payment time, you should be given interest, as your accrued interest is taken from you if you haven't made the paybacks, and looking at this new 90-day payback deal that Medicare is coming up with.
Right. I mean, I got to pay for money. Money's not free, whether it comes from a bank or even if I have the money, there's a cash value to that money. You can earn money with that money.
And my staff likes to be paid every couple of weeks. And you're right.
Yours too.
Yeah, I know it's so annoying, but they want to be paid for working for me. I don't get it.
What should you expect when you appeal a claim? I mean, is there a process? Is there a simple step-by-step manner?
Simple, no. It really depends on the payers. But typically, there is a process that's in place. The difficult side from the public insurance, Medicare, Medicaid, and the private insurance, Blue Shield, Aetna, Humana, United Healthcare, is that the private sides are more in what's always been called a black box. So it's harder to figure out exactly what they expect. But an appeal is typically handled through several levels. There's typically one or two at the beginning, which is simply saying, hey, I provided a service for Dr. Robotsky. He was my patient, and I should have been paid for it. And the insurer will say, oh, yeah, we made a mistake, or no, we don't cover that for this reason.
The hard part is level appeals. Do people win? I never was successful. I mean, it was a matter of filling out. I sent a form letter, and it got ignored most of the time.
And I think that's part of their plan, Brett, is because eventually they're going to wear you down where you're going to quit. So what's the percentage of winning first levels? I'm not sure. I know the level at the highest level of appeals is extremely high for physicians. We're talking 90% worth, especially in the Medicare side of things. But it's difficult to get that level. So going back to your question is, the most important part is you need to start the process. Yes, it's time consuming, it's expensive, and it's annoying, but if you don't do it, I guarantee you will not be paid.
You get, 100%? I missed 100% of the pitches I didn't swing at.
Exactly.
So you start doing this, you get to this. When do you want to ask or demand or highly request a board-certified podiatric reviewer? When is that important?
Well, typically that comes around at the second or third level when you're asking for some kind of a peer review. And with no reflection on the nursing community, most of the people who do the peer reviews at the first levels and even second levels are the nurses that work there. And occasionally you'll get to the level of the medical doctor, and very infrequently you'll get to the actual peer you mentioned, the board-certified podiatrist, who knows exactly what you're doing and understands that. So that's typically at the higher levels. And interesting is that's the time when most of the time we win our appeal.
I would think so, because one, I can't imagine anyone fighting an appeal on a case that the notes don't give you the merit.
Right, and you know what? You made a great point right there too. Documentation is so important. One of the things that I do, Brett, right from the very beginning is I include a copy of my documentation, and I've even made form letters now discussing the convention of coding. And that if you follow the convention of coding, these codes should be paid appropriately when they are put together with this modifier, et cetera, et cetera. And do I win? About 30% of the time. on the first level.
First, well, that's pretty good, 30%, because you save time is money. So as you push this forward, I remember the ALJ, the Administrative Law Judge of Medicare, used to be great. Used to get there within 3 or 4 months. You had your hearing. The guy talked to you on the phone. He was so impressed he got to actually speak to the doctor. Always won. Well, now I'm waiting 3 years.
You're right. And here's the interesting point is that the ALJ by law had 90 days to move your case forward and to solve it, as you said, the 3 to 4 months. And then a couple weeks later, you're actually being reimbursed. And we won about 93% of the cases at the ALJ level. Right now, the wait is 119 days, I believe. 819 days.
Oh, 819.
819 days. So you're looking at a 3-year window now to get to an ALJ. Well, again, the old coding cynic in me says, of course they do it that way, because the longer you wait, the more you're going to forget about even following it. And we win all of those cases.
Right. And the rules change over the 3 years. You know, you might be applying for something in 2013 rules where 2016 the rules are different.
You made a great point, and I think something to segue with that was that it's important to know the rules too. And what that means is you need to go on the carrier's website. You need to look at your contracts. Most of us have never even taken a look at our contracts. We just sign them. Well, I need to be a member of Humana's policy plan. I need to be a member of Humana's, level 2, whatever we could call it. But you need to know the rules, because sometimes we sign off on things that say, oh, well, I won't bill for more than one service in a day. And so it's important to understand those
fine
rules.
Print too. Is a tricky thing, I guess.
Oh, yes, it is. And the rules of coding, which are important to understand.
These are things that get me to, when do we get our state involved, our CAC reps, the different people who have volunteered of themselves, as you did for many years, to be that person to tell us, to read the small print, I hate to say it.
Well, that's a great question. And I think from the APMA level and the CAC level, we typically would try to take on cases that appeared to have much more regional or national significance, okay? But that being said, the CAC and the PIAC rep, or the Carrier Advisory Committee and the Private Insurance Advisory Committee, the CAC and PIAC, they are there to serve you. And interesting enough, they are by law available through Medicare. So it's not just something that APMA does. CAC reps exist across the country. We're one of the only professions that has a national CAC committee, which is pretty cool. But when do you go there? If you've gone through an appeal level or 1 or 2 and you're getting frustrated, or you're seeing multiples of the same sort of occurrence, that's when you want to get the CAC rep involved. Let's say you're the CAC rep, Brett. I'm going to give Brett a call and say, hey, I've been using this code and this code in combination, and all of a sudden they're all being denied. I don't know what's wrong. Then you might find out if there's a pattern that's actually occurring in the entire jurisdiction or even nationally.
Okay, so obviously we want to spread the love, but
yes,
I win at some point.
Yes.
Eventually I win.
Yeah,
how do I share that?
I want my 15%.
50,
that's
20.
I
thought you got 20%.
I'm coming to Florida.
But how do I share? If I figured out, at 880 days, they finally gave me win. This is my notes supported everything I said I did, and I win. Should I be sharing that?
Absolutely. And one of the best places to do is to go back to that same CAC or PIAC rep, or go to your state association, go to your local meeting, the Palm Beach Association, whatever that may be, and say, look, guys, I found that there was this trend where 11.719 and 11.056 were now having one of the codes always denied. And I found out that I was doing the ICD-10 coding wrong, or there was a code problem that was occurring at First Coast, and you know what? We got it fixed. Here's what you guys should know. So part of the sharing is simply amongst your friends and your colleagues. I might call Brett up and say, hey, what the hell's going on in Florida right now with this whole coding thing? So, and even going back to the association and telling someone like Mark Block in Florida, or calling Frank Campo in Massachusetts, whatever, and letting them know that this is a situation you had, this is a situation that worked for you or didn't work, and sharing that information.
Well, incredible knowledge, incredible things to check on. Please go to the forum. Give me your opinion. forum.podiatricsuccess.com. Thank you, Mike.
Thanks, Brett. Always a pleasure.
Pleasure.